Drug interactions. We have been discussing these points that there is actually a 2 to 3 hour interval. If this is observed, means if we indicate drugs after 2 to 3 hour, suppose I'm using one drug, and if I'm taking the second one, and I take the interval of about 2 to 3 hour in between these two drugs. I take one drug, then I wait for 2 or 3 hours, then I take the second one. So then there will be very low interactions. We can say we can reduce the interactions, the ADRs, adverse drug reactions, the drug interactions can be reduced. So now, keeping this in mind, let's come to this slide. Here we have ibuprofen and aspirin. You guys might have observed that when it is about ibuprofen and aspirin, these should not be taken within 12 hours of each other. God, should not be taken within 12 hours. Now, this is the very point to be remembered. Within 12 hours. A moment earlier in the previous slide, we discussed that if we indicate one drug to the patient and we wait for 2 to 3 hours, then we indicate another one, there will be no complication, no ADR. But here, regarding ibuprofen and aspirin, if you are taking these two medication, and if we do not take care of the time of the interval, and we indicate after 2 or 3 hours, there will be a kind of interaction seen that is actually of the ibuprofen and aspirin. So then ibuprofen will interfere with the aspirin's cardioprotective benefits, okay, in cardioprotective action. So like this is actually going to have interaction. So for now and for future, we must consider each and every drug with another drug if we are taking 2 3 medication. So we must go through the interactions, whether our one drug is interacting with another or not. If it is interacting, what should be the time interval? We must focus on the time interval.